Hello, everyone. This is Professor Kennedy Edem Kupia. Today, we are continuing our journey on dissecting pharmacology. And previously, in dissecting pharmacology, we discussed the basics of pharmacology. And in that discussion, we tried to look at what pharmacology was about, the divisions of pharmacology, and the relevance of studying pharmacology. Now, when we looked at the divisions of pharmacology, we mentioned that there were divisions like pharmacokinetics and pharmacodynamics. Today, we are looking at one aspect of pharmacokinetics, and that is drug absorption. I believe this is going to be quite interesting. Just sit tight and enjoy this video. We would hopefully have some more discussions when this is over. So at the end of the session, we would want to be able to explain what drug absorption is. It's crucial to be able to explain the concepts, because once you have a good understanding of the concept, it allows you to be able to apply it to different situations. So we should be able to explain that concept, drug absorption. We also want to be able to discuss the relevance. Why do we need it? Is drug absorption really necessary? If it is necessary, why is it necessary? And then lastly, we will discuss the factors that influence drug absorption. Now, the issue is, if it is necessary, then we should make sure that it is as efficient as possible. But if anything influences it negatively, we should be able to know, so that if you are a health professional, once you know that this factor can influence drug absorption, if you have control over it, you find a way of manipulating it to be able to get the best out of the drug absorption. So we will look at all of these concepts, and I'm sure it will be quite simple for you to appreciate. Now, when you talk about drug absorption, just picture a scenario. Just give me a moment. Pick my pen. So picture a scenario where you have drug molecules. So these dots are my drug molecules, all right? And then let me change the color. And then this is my blood vessel. Now, anytime the drug molecules make entry into blood circulation, or sometimes we consider the lymphatics, we say that drug absorption has occurred. So simply, drug absorption is the concept that explains how drugs move from where they were administered into circulation. So when a drug moves from where it is administered and makes its entry into circulation, we say that absorption has occurred. Now, this process, with few exceptions, is very, very important, because how well a drug is going to work is largely dependent on how well that drug is absorbed. Of course, we have some exceptions which we would address later, but it is necessary to know that for most drugs that we administer to patients, we administer those drugs that they may perform a particular function. And in order for those functions to be performed, most of these drugs must be absorbed. And as we have already mentioned, absorption is one of the pharmacokinetic processes. In fact, one of the important processes. Now we'll take an illustration. So let's pick just a simple illustration. Let's assume that someone is supposed to take a tablet. Now we know that not all drugs are in the form of tablets, but let's assume that the person is taking a tablet. What are the things that will happen before that tablet the person has taken would be swallowed. I mean, the tablet the person has taken will be absorbed. Now, if you should pick that tablet, one of the things that will happen to the tablet is that it breaks apart after it has been swallowed into the system. It breaks apart in the gastrointestinal tract. Now, that breaking apart, the process by which that drug tablet breaks apart is basically what we call disintegration. Disintegration. So from this diagram, you realize that this is our tablet. This is our tablet. And you realize that there are smaller particles that has come out of this tablet. Now, let me just explain briefly that for most drugs that we take, if you swallow a tablet, there is the active component, which is the drug itself, and then there are what we call excipients. Excipients. Now, the excipients have roles they play, which in one of our videos we would explain. But our interest is in the active component. But the active component is together with the excipients in this tablet. And so in order to get access to that active component, first the drug has to break apart into smaller units, and that is what we call the disintegration. Now, after the disintegration, the smaller particles need to be dissolved in the fluid within our gastrointestinal tract. And that is the next process, and we call that next process dissolution. So when these particles that were achieved, or the particles that we got from the disintegration process, when it gets to be, let me put it, submerged in the solution or the fluid within your GI tract or the gastrointestinal tract, we say we have dissolution. Now, the rate at which this disintegration and dissolution takes place can influence the rate at which the drug gets absorbed. So if disintegration is slow, if dissolution is slow, it is also going to make the rate of absorption quite slow. So usually, if it is a tablet that has been swallowed, from the point of disintegration to dissolution, then we can have the drug moving from the gastrointestinal tract into circulation, as we can see here. So you realize that the drug is moving from the gastrointestinal tract into circulation. So that movement into circulation is what drug absorption is all about. And I hope this is simple enough to understand. Now we come to the relevance of drug absorption. Why is drug absorption relevant? Why is it important? Now, we have already said that with few exceptions, almost every drug we administer must be absorbed in order for it to do the work we want it to do. Now, for the drug to do that work, there is one concept you need to appreciate or grasp. We call that concept bioavailability. In another video, we will take our time to go into details. But briefly, bioavailability, the symbol for it is F, surprisingly, not B, but F. It is usually the fraction, or it is defined as the fraction of the drug that reaches systemic circulation in the unchanged form. The fraction of the drug that reaches systemic circulation in the unchanged form. Now, so let's say I gave you 100 milligram of a drug, and out of the 100 milligram, about 65 milligram reaches systemic circulation in the unchanged form. The word unchanged means that it is not metabolized. So it means that the 65 milligram of the drug is what has gotten to systemic circulation without being metabolized by the system. Now, if this 65 is what we got, we will calculate the bioavailability as 65 divided by the 100 that was originally given times 100%. So this 100 will cross out this 100 and then we get 65. So normally we would either express bioavailability as percentage or fraction. So 65%, or in the form of fraction, it becomes 0.65. So meaning that the bioavailability of that drug is 65%. Now, drug absorption is one of the processes, important processes, that determine the bioavailability, or that determines the bioavailability of a particular drug. And that bioavailability also determines three important things for the drug. One is the onset of action, two is the duration of action, and then three is the intensity of drug action. And so how quickly the drug works, how long it is going to work, and the strength with which it works, let me put it that way, that is intensity, is what bioavailability influences. So if we are saying that drug absorption would influence bioavailability, then invariably, how well the drug is absorbed will determine how quickly it works. It will determine how long it is going to work, and then it will determine the intensity of action. So if I have two drugs, A and B, let's say 60% of A is absorbed and 80% of B is absorbed. All things being equal, I expect that B would work faster than A. B will work for a longer time than A, and how well B works would be better than A. This is an overly simplified way of looking at it, but that helps you to appreciate the concept. And so if the drug is absorbed well, then it starts working faster. A drug that is not absorbed well may work very slowly. So you take the drug and you are waiting for the drug to produce an effect, and it's taking a long time for it to work, probably because that drug has not been absorbed as quickly as we would have expected. And remember, we have said that the absorption is preceded, depending on the kind of drug we've given, the absorption may be preceded by the rate of disintegration and then the rate of dissolution. So meaning that we start from the disintegration, the dissolution, we have absorption, which influences bioavailability. Then that will also influence the onset, the duration, and then the intensity of action of the drug. I hope this makes it simple. Now,